welcome to our very first of many HELP training sessions. Ted recognized that our group is full of many unique health educators and practitioners, and we wanted to tap into their knowledge and experience and learn from them, so he launched HELP. As a reminder, we do not diagnose, treat, or cure any diseases. We are here to learn how to further our general wellness goals. Tonight, we are so privileged to have our very first speaker of our HELP training sessions be Dr. James Kneller. Dr. Kneller is a board-certified cardiologist and cardiac electrophysiologist with special expertise in heart rhythm disorders. He completed a bachelor's in mechanical engineering, then a master's in bioengineering, then earned his medical degree from McGill University, Montreal, Canada, and holds a PhD in anti-arrhythmic pharmacology. Dr. Kneller conducts research in the area of cardiac electrophysiology and does peer review for major scientific journals. He has 650,000 followers on Facebook and 40,000 subscribers on YouTube and is a fountain of information. He has practiced allopathic medicine as a cardiologist and electrophysiologist for over 10 years, but recently he has started a clinic as a holistic cardiovascular consultant with Natural Heart Doctor in Scottsdale, Arizona. He is passionate about optimized personal health with a deep interest in complementary alternative medicine, also known as CAM. He strives to reduce the need for pharmaceuticals, invasive procedures, and exposure to harmful radiation. He strives to help each and every client to live well, eat well, and think well, and to attain their 100-year heart. Dr. Kneller was introduced to LifeWave in March of 2022 at a health fair in Vancouver, Canada, and has been using the patches in his practice ever since. In fact, he has actually done 4 LifeWave research studies on his own. We are so thrilled to hear from such a well-educated and experienced doctor. Dr. Kneller, I now turn the time over to you.
Well, thank you, Elizabeth, for that very kind intro. I really appreciate it and appreciate the opportunity to be here. So what I've had a chance to prepare for tonight, like Elizabeth said, I'm in full-time practice here in the Phoenix, Arizona area, both in a conventional cardiology electrophysiology practice, and that's with Arizona Cardiovascular Care here in Tempe, and then also doing natural heart consultations with Natural Heart Doctor, which is based in Scottsdale, Arizona. And that's a lot of fun. And that service attracts consults from all over the country and the continent who can have their consult with us through Zoom or in person in the Scottsdale office, but at least 80% of those are through Zoom. And we really attempt to help people improve their health. I kind of took it as the mandate to talk about some of the research that I've done with patches, and we can talk about the patches in an interactive way, around what I'm presenting and taking you through. And several of these are case studies, which are the sorts of examples that we all hear about, these wonderful stories of healing and benefits from the LifeWave technology. I'm trying to formalize some of those case studies in an actual published format. I think it gives them a little bit more credibility, makes them a little bit more shareable, and hopefully then becomes something that I can share with my patients and say, look, I really actually do have a track record in this industry, and you can go on peer-reviewed journal sites and read some of the experiences other people have had and some of the studies that we're conducting. So that's kind of my goal. And also my background's a PhD. I did hardcore research at one stage in my career, and I missed that. And phototherapy with LifeWave patches is an awesome opportunity to do research for several reasons. The patches are relatively inexpensive. They have immediate results. You can measure before and after 10 minutes apart. And you don't need much in the way of consent because no drug or chemicals entering a person's body, which takes care of a lot of regulatory concerns, which can bog down research effort. So I kind of feel like this fell on me serendipitously, and it's allowed me to find a new avenue of scientific engagement that I'm having a lot of interest in or a lot of fun with, and feel that is actually quite fulfilling. So I'll just take them in order of the studies, 2 case studies, and then 2 larger multi-person or subject trials that I've been working on. So let's talk about the first one. And this is phototherapy to mitigate the complications of left heart catheterization with transradial access. That's a case report, so a single patient experience. And we published that in 2023 in the Journal of Interventional and General Cardiology, which is an open access journal. It is not listed on PubMed, but it is on Google Scholar and a couple other academic indices. And if you Google on LifeWave research, that will quite reliably come up. And most studies that you need come up on Google rather than on PubMed, for example. So this is what the brief case report looks like. And what we were doing in this study is helping to treat somebody who had a complication from a procedure that we do very commonly in cardiology. I'm not an interventional cardiologist. I don't do coronary angiograms. My colleagues do. This was a patient who I had referred out for this procedure and came back to me after that procedure having troubles. So this kind of illustrates the concept of what happens. If you'd like to image someone's coronary arteries, the way to do that is to advance a catheter through the arteries to the heart, and then you can inject contrast dye into the arteries, both the left and right coronary arteries, and then take fluoroscopy images of those arteries to assess the anatomy, look for idiosyncrasies, obviously look for atherosclerotic plaques, obstructive plaques. You can take that opportunity to deploy a stent if you feel you need to, or that's in the best interest of the patient. Or if there is extensive coronary disease, you can refer that patient for bypass surgery. So the angiogram itself involves placing this sheath in someone's radial artery, and there you see inserted, and on the other side you see a diagram of what that sheath looks like. So the sheath goes in, the sheath goes out. It's usually quite convenient and innocent. This individual had severe pain at the site of access, had numbness in their fingers and decreased mobility, and that they weren't able to grasp even a sheet of paper anymore because of the nerve compromise. So there's a lot of structures going by there, and somehow the nerve had been traumatized, and they were quite limited by this. And I took that opportunity couldn't resist, to pull out my IceWave patches to see if we could improve on things. And as we see so many times with LifeWave, had immediate and astonishing results, which continue to surprise me and were very important to our patient. So again, here you'll see the IceWave patches as we would apply them. The tan patch, the negative patch, on the point of maximal pain, which is a common strategy, and then you can map around that patch with the white patch to see which vector minimizes the pain. So David will say that pain represents a disruption of electrical charge flow. And when the body recognizes that an obstruction is present, it assumes that means there's tissue damage. And so it causes you pain so that you do something about it. So what you can do with LifeWave is with the polarity of the patches, is you can redirect the flow of charge away from the site of obstruction in such a way that the pain symptom resolves or dramatically improves. So this was we did that. This was the configuration of patches that we found best alleviated the pain after, mapping around in a number of locations. And, the patient automatically, pain from 10 of 10 down to 3 of 10, got her mobility back, pincer strength. Suddenly she could hold paper again. And this was all very dramatic. And of course happened within 10 minutes, and everyone was thrilled. So that motivated me enough to say, this is one that's worth presenting. And for the sake of the journal article, I, published a gripometer on Amazon, which is something that measures the force of your grip. And we met again later, after the patches had been off, and measured grip strength before and after applying the patches, in addition to doing, some neurologic maneuvers, 2-point discrimination, things like that can test neural function. But the objective finding was that grip strength, was improved by 50-60% within 10 minutes with the application of the patches. And then you have the qualitative reduction in pain, and then also some of the other measurable things like discrimination, numbness, basic neurologic testing. So we put, improvement in 3 areas: strength, pain, and nerve symptoms. And we're able to get that one accepted for publication. So, I'm sure you've seen reports as astonishing and as remarkable on the different Telegram groups that we share around. But here we have one that is published, and this is available to any of us online. And we can download it and say, and share it with our friends and clients and those who are asking, to help market the product, educate our clients and customers and friends about LifeWave, and give them the confidence they need to actually try the product and have their own experience. So that was our first publication back in 2023 as a case report. The second case report is actually it's actually in review right now with the Journal of Innovations in Cardiac Rhythm Management, which is a fairly prominent workhorse level journal in our industry. I proposed to them. I've heard from the editor that I'll be hearing back sort of within a week, whether they're going to accept that for publication or give me feedback on any revisions that they would want. This is one that I spent a lot more time on and was much more invested in, and that is using phototherapy to facilitate wound healing following pacemaker infection. So a promising tool to improve patient outcomes. So here we're using the LifeWave technology to improve wound healing, which is a really great application. So then the slide I'll show you is a little bit graphic. So if you don't like blood or things like that, you may want to look away just for a second. But really it's not too dramatic. Here is kind of the sequence of images that tells the whole story. And importantly, these aren't the exact photos that I submitted in the manuscript. So those stay confidential and proprietary to the journal. But in this study, we estimated that wound healing occurred 50% faster with the X39. So on my left side of the screen, you'll see what looks like a kind of an infected area of the skin, and that's in fact a pacemaker that was infected and now has become so infected it obviously needs to be removed. What we fear in cardiac rhythm management is that if an infection ever gets on the hardware of your device, you can't get it off. There's no antibiotics that can sterilize the device. If it's truly infected, the only solution is for the device to be removed. So here is an infection that declared itself truly, and that mandated removal. This is in a woman in her early 80s. And when you remove a heavily infected pacemaker, you need to debride all of the infected tissue surrounding it, and then if there is still infection remaining, suturing that wound closed can be problematic because there may still be infected material that you missed, which can cause it to reinfect. So actually a common strategy in that scenario is to do wound healing by secondary intention, meaning you leave the wound open and you put the patient on a protocol of packing the wound with iodine impregnated gauze and other things. You change those frequently, and that wound will heal by secondary intention, meaning it will eventually just shrink and disappear to nothing. So given the size of the crater, which you see on the second panel, we decided that was the strategy that we were going to do. So we enroll the patient with home wound care. The wound care nurse visits her in her home twice every other day initially to change the packing, clean the wound, And for the sake of this individual who was very important to me, I set her up with X39 patches to wear next to the wound and taught her to change them out on a daily basis, etc. And she did that. And you can see there's the X39 kind of next to the wound, and there it is, much smaller. And that's only maybe 2 weeks into the process. And then finally, eventually, scar formation did occur and the wound was completely closed. And then we continued with the X39 patches to watch that scar remodel and get smaller. And I probably continued that process for a total of 6 months to see just how organized the scar would get. And that was kind of how it looked. But from the wound care database, these people do these things professionally. They see all kinds of wounds. And compared to their similar cases, they estimated that wound healing occurred 50% faster with the X39. They were astonished at the rate of closure and, how quickly that guy healed himself. And again, this is a very elderly woman who's not bedridden, but has limited mobility, not the picture of health, but still obviously able to elicit a healing response with the patches that was quite accelerated. So in my industry, that's a remarkable story because, us electrophysiologists have to unfortunately deal with pacemaker pocket infections from time to time. And internationally, it's a substantial issue. So I'm hoping that by demonstrating the use of X39 in this particular context, it can spark some discussion among my colleagues about ways to help these things get better faster, because it's quite a bit of morbidity for the patient and a headache for everyone else to watch these things heal when they take as long as they can sometimes. So that's an exciting result. Let's hope the reviewers smile on us and this one gets accepted. But that was an exciting result for me and someone who I was super invested in. And then, of course, she gets all the ancillary benefits of wearing X39 patches. Her sleep apnea improved. She felt more energetic. She was sleeping better. Her appetite improved. She was ambulating more around sort of the semi-assisted living residence that she's set up in. So lots of benefits for her in addition to the wound healing that she was really thankful for. So that's our second major result. So if you have a wound or a cut or something, I think it's a no-brainer to use X39. And we placed this one right next to the wound. We might have placed it on the back of the neck and gotten the same result. But we placed it next to the wound and just kind of randomly alternated side to side, and it closed up. But this is my go-to for any wounds that become my problem, and certainly that I have or that my friends and family have. And I think it would behoove everyone else to use the same strategy. Super cost ineffective when you think about the burden of care these people are having otherwise, paying a new wound care works to show up every other day, change the wound, that's expensive for the insurance companies and for the patient. And if it can go much faster with X39 technology, why not use it? So let's hope that that message gets out. Now moving into the multi-candidate study, and this is something I've done for myself, and Ted volunteered recently and underwent this protocol. But we're, again, looking for evidence that the LifeWave phototherapy technology is changing our physiology. We know that it does, but, can we measure it and how can we image it? And I actually got I got the idea from one of Ted's talks, actually, where we know that the patches are activated or they reflect back into us some of the infrared energy that we're emitting. So we're always emitting infrared, and that arises from the molecular activity in our cells, the cellular metabolic activity. This infrared is generated. And then what the principle of LifeWave is to have a crystalline patch have an organic crystal embedded in the patch, which acts as a mirror, and it will then reflect back into you certain frequencies of the light that you are emitting. And those frequencies are known to have specific biologic functions. So that's the principle of LifeWave, and Ted showed a picture of one of his auras, and the slide said that, that's your aura, and that's the energy that's activating the patches. So then you would think if your aura is activating the patches, and then the patches are reflecting back or reflecting energy back into you, they should then be changing your aura, maybe in a way that's appreciable and that we could image in pictures. So I found a local aura camera. You'll get very familiar with these things walking around Sedona, Arizona, for example, where everyone's into energy and woo-woo and vibrations and vortexes. And so there's lots there, but they're also here in Phoenix. And, I've gone to one commercial aura center to do some preliminary experiments with aura modulation. And I can take you through, I'll show you one example of a volunteer friend who did the experiment with us. So you go to the center, you rest in their chamber. What you're doing is you're placing your hand on a metallic grid that somehow senses your energy. And then when they measure that your energy has stabilized, they then take your picture. And that's your aura photo. So it offers it commercially, and you get an interpretation about what your personality may be like and things like that, and away you go. So very good. So here we do a baseline aura photo, and then we know auras change. Our energy changes if you change mood, if you get interested, excited, depressed, angry, whatever. But the thought was, if you can just kind of get yourself in a Zen mind state, take your picture, put your patches on, wait maybe 20 minutes, and don't look at your phone, don't get engaged, don't have a huge conversation with anybody, just kind of stay in your same state of mind, that hopefully we can isolate the effects of the patches. So here we see this gal before and 20 minutes after applying an Alavita patch to her forehead. And I blanked out her eyes just for privacy, but just above that blocks, you can see the Alavita patch that's on her forehead. And started using Alavita after doing some other pilot experiments on my own. So I would go in and say, okay, I want to see an aura change. So what should I do? And I was putting on X39, X49, energy enhancer across my arms, across my legs, just get fired up. So hopefully we can see a change in the aura, and sure enough, those preliminary experiments did show color changes. And you're like, all right, this is working. And then the thought was, well, rather than repeating that protocol, and I did it kind of maybe in 6 volunteers, like, why don't you try something else, James, and see if you can come up with something else that's interesting. And I actually found that the single Alavita patch was eliciting larger color changes than all of those other patches in combination. So for whatever reason, I was seeing larger shifts, and that's of course more interesting. And initially I was doing it with the Alavita and then energy enhancer from sort of the base of your spine to the top of your head, and you get energy flowing up your spine, up towards your head and your brain, your pineal gland, then activate it even more with Alavita, and hopefully you see a good color shift, And you start to suspect after a while that maybe the patches work against each other a little bit in the total aura expression. So I really narrowed it down now to just the Alavita patch on the forehead. And I think that's giving me as dramatic or even more dramatic results than otherwise. So you can kind of see the color changes around her. And part of the printout that they give you is sort of this whole body aura photo, where you can see you can sort of see the 7 chakras up the spine, and the size and the color and kind of the shape of it tells you something about the energy that you're holding in your body at that point in time. So those changes occur. But then more importantly and more dramatically is you see the shift from a green-yellow hue, and there's insights into what side of the body, up or down, has the color changes or whatever. And you can really get into this. But clearly you can see kind of a dramatic shift, and on the after photo, kind of interestingly, that yellow glow around the head, which is where the patch actually is. You could say, well, maybe she kind of had that in the pre-photo, but it's harder to identify. But they're, an interesting different color, knowing that the patch is right there on her forehead. So then they give you part of your printout, and you don't get this as a PDF. So I had to scan all of this. They'll, on the before, you'll see what her color scheme was. So she was somewhere between orange, red. And then interestingly, after the patches, she shifted to being between red and deep red. So the computer said, we really did see kind of this stepwise jump, which is interesting. In this particular example, I would say demonstrates the paradoxicality of the patches, in that sometimes you get people where they don't work, or they seem to maybe do the opposite. I think we get some strange experiences playing with them. So if you activate Alavida, that should be your higher chakra, for lack of a better expression. And most people do shift from being red, orange, or green towards violet, or lavender. So they're moving down the spectrum. And I really wish they would have flipped this over, because violet, lavender is kind of your higher chakra. So anatomically, it would have been correct if they flipped it. So most people move down here, which is really moving up the chakra system. And you see a shift from those lower, more carnal chakra areas, physical energy, competitive, winner, willpower, entrepreneur, to imaginative, mystical, fantastical, fragile, sensitive, etheric. But she had a measurable shift, which is, of course, very interesting. But then interestingly, hers was a little bit paradoxical, where it seemed to move down the chakras rather than up the chakras. Other data that you then get is they will tell you, your frequency spectrum or your vibration rates. And I don't even know if this is in hertz. It must be in hertz. So it could be like 200 to 800 kilohertz. I'm not sure how they're measuring this, but they'll present this to you and say, here's your data, when you take your shot, before and after, for example. And it's not fair too, because the scales are kind of changed. But here, what would these recommend? So the indigo channel represents your intuitive energy. The green bar is your mental energy. The light blue channel is your emotional energy. And the red channel is your physical energy. So before, she had energies kind of at 450 up to 600,000, depending. And then after, her energies kind of went down and all stabilized at about the 450 range. So most people, I would say, as you see the higher chakras activate, their rates of vibration increase, and this is the kind of language that you'll hear from chakra people. They're all like, you got to raise your rate of vibration and vibrate at a higher energy, and you'll be more productive. Your influence will go out farther, and you'll be more effective. You'll be more in tune. Raise your rate of vibration. So we hear that a lot. And the patch can literally, as this thing measures, raise your rate of vibration. But in certain individuals, sometimes paradoxically, it can go the other direction, at least by how these things are measured. So we expect a certain response from the patch, but then it really is for the individual to be honest with themselves and say, am I with the majority, and did that really happen to me? Or do I happen to go the other direction? For whatever reason, again, we don't know the frequencies of infrared that we're emitting. We don't know how much of each frequency we're emitting. And when a patch reflects one of those frequencies back into us, I would have to say we really can't predict with certainty how we're going to respond to that. So there is room for just personal experimentation. And I'm sure we've all done that, and certainly seen some people who are instant responders with the patches. Wow, this is amazing, all these changes, and other people who are like, can't really tell a difference, And that may be the patch, that may be the energy they're emitting at the moment, that may just be kind of their physiology. I think we just have to be honest with those things and recognize that they exist. Nevertheless, what we're finding here, and again, what I really wanted to show, was that the patches do substantially change your physiology. So your aura is activating the patches are reflecting on the aura, and they can change the shape of your aura in a way that's, hopefully quantifiable to the degree that this technology is accurate. Anyway, additional data that they would show you is they would say, what percent of your persona is mind? Are you in your mind, or are you in your body, or are you in your spirit? And here's a gal who kind of went down the chakras, if you like. So before, she was 40% body, 40% mind, 20% spirit. And then moving down the chakras, the graph they print out is now she's 60% body and 30% mind and only 10% spirit, so kind of moving in that kind of basal, more carnal direction, if you like, for lack of a better expression. Again, what's interesting, large changes and impressive changes. And of course, these are only 20 minutes after applying the patch. The person hydrated before the entire experiment. They didn't hydrate in between the baseline patch and the activation patch, and sorry, the aura photo with the patch. So it was hydration prior. So hopefully their physiology was pretty much unchanged, right up between baseline and the point of actual measurement. So that one too, I have actually submitted to American Heart Association Basic Science Cardiovascular Symposium for 2024, which would be in the fall. And kind of best case scenario is that would be accepted as a poster presentation. So I've been collecting subjects and, starting to collect averages and try to put some statistically meaningful data together to present scientifically. So hoping to hear back in the near future about whether that abstract will be invited for presentation. And if it's not, that's fine. We still continue the study and the data just gets stronger. And there's other forums where you can share these sorts of things. But that one is, that aura photo is my favorite, and it's particularly intriguing and really fun for everyone to see their color shifts. So then as a final one, this is very cool too. So phototherapy to stimulate carnosine activity and enhance myocardial function. So a promising adjunctive therapy for congestive heart failure. So this is to say, we know that carnosine is this dipeptide. It's very elusive in the body, but it's everywhere. And it's very involved in muscle function. It's very involved in inflammation. It's very involved in detox, this little molecule carnosine. But especially it's involved in muscle function. And this was the first patch, or maybe the second patch, that really convinced me that there was something about phototherapy. So I do a very repetitive hike here up Piestewa Peak, for those of you who know the Phoenix area, and can really kind of tell if I'm tired or how in shape I'm doing, if I ate too much last night, based on how well I do this hike, because it's very repetitive for me. And started once I received my first pack of patches, I started to hike with the carnosine patches on, and felt quite early that I was all of a sudden on an escalator, just zipping up this mountain in ways that was astonishing even to me. And so the only thing that had changed, honestly, was carnosine. So you have this real intuitive sense that this can really improve cardiovascular performance and muscle performance. Now, how do you quantify that becomes another issue. So you have to ask very nicely, but in my field, we do have access to echocardiography. So you can take ultrasounds of the heart, for example, and can we demonstrate an increase in heart contractility with phototherapy in a way that's quantifiable by echocardiography, and really demonstrate this property of the patches. So that's another study that I've started, and submitted that one as well to the American Heart Association Basic Cardiovascular Sciences. I'm waiting to hear back on this one as well. But from preliminary preliminary subjects, an increase in heart squeeze function of 4 to 6%, within 20 minutes of applying of carnosine patches. And to me, that's astonishing because we fight for 5%, 10% in patients' heart health when we're treating sick hearts. So to think that phototherapy may be able to achieve that in a way that we can demonstrate objectively, and that I think our field would have to pay attention to, hopefully will be demonstratable and as compelling to everyone else as I think it is to me. So how does that work? And again, this is something that I played with. On the right, you see that's the setup for an echocardiography study. So you have an echo machine and a very experienced technician who knows how to do ultrasounds of the heart and get high quality pictures. So they're trained, they're expensive. Someone owns the echo machine. How are you going to get time on the echo machine? So a friend in our clinic, Echotech, who's a good friend, has allowed me to do some preliminary experiments with that. And, I wanted to demonstrate, that the patches change heart function. So where are you going to start? And I kind of took the same approach that you would do as with the Aura photos. It's like, okay, let's put energy enhancers. I need them across my chest. I want them on my arms. I want them on my legs, X39, X49, pile everything on. And did the ultrasound before and then apply the patches in 20 minutes after. And the initial results were like, disappointing. Heart function actually went down. So thinking about that, why would that be the case? I've reduced inflammation. Hopefully I have more energy flowing. And I think what it was is the effect of energy enhancer. So we know energy enhancer is the opener. It opens channels. It would tend to dilate blood vessels. And if you're at rest and your heart's working so hard to maintain your circulation, if you then dilated your blood vessels, so there's less resistance in your blood vessels without any more metabolic requirement, you're not exercising, you're not going anywhere, what would your heart do? It would say, I don't have to work as hard to maintain you in the state of rest, so I'm just going to back off a little bit. And in fact, I think that's what we were measuring. So then, and that was kind of using advanced protocols for how do you improve your circulation, things like that. It's much more impressive if you can improve that heart function increases. So that, after scratching my head for a while, begat this protocol where, again, remember, getting in front of an Echotech is hard to do. So the idea was to plaster carnosine patches over the heart area, right around to the axilla, because the heart goes deep into your chest, and try to activate it maximally from every direction possible to see if we can just get appreciable change in heart function. So that became the carnosine protocol, and one that is more interesting for sure. So this is my heart on an echo, and that's before. You can see the heart functioning. That's right. That's the 4-chamber view, left ventricle, right ventricle, left atrium, right atrium. And then on this panel, post, that's after the carnosine patches. And it's on this view, it's really hard to appreciate an obvious change in function, right? My problem was, not to brag, but my heart was so vigorous at baseline, it kind of didn't have far to go, So it would have been nice to start with someone who had a little bit lower baseline function. Nevertheless, we can use this high resolution, what we call the M mode, to really measure how well the heart muscle is pulling together during its contractions. And here at baseline, you can see that the estimated ejection fraction, what volume of the heart actually empties when it contracts, 77% here. This is the measurement the computer came up with, and that's what I would call high normal. So that's a high normal measurement. Put on the patches, and what does that measurement become? Here, 81.6%, So there you have a 4+% increase in heart function, at least measured by this protocol, showing that the muscle is in fact beating more vigorously, you know? And then there's other parameters we can do, and that is to say, when the heart muscle contracts, obviously the muscle has to get shorter when it contracts. So what is the rate of shortening? So we call that the tissue Doppler. How fast does the tissue itself squeeze together? And you can do that and we do that on the lateral wall of the heart and on the septal wall of the heart using a very specific sample volume on the heart that the echo knows to focus on that region and what are the velocity changes in the tissue right in that little focal region. And you can see here on this medial E prime velocity, that's what we call tissue velocity on the septum, that reached a maximum of 6.53 centimeters per second. So when the heart contracts, the fastest it moved was 6.53 centimeters per second. So then you add the carnosine patches, and what does that number go up to? Now look at this, 7.31 centimeters per second. So when the heart muscle contracts, it's moving faster at its maximal velocity in response to the carnosine patches, with a change in the overall squeeze function of 4 to 5% as measured by the M mode. You know, so here we're getting some quantitative data that says applying carnosine patches to the heart can give you an objective change in heart function. You know, again, within 20 minutes. You know, is it practical to put 10 over your heart? No, it's probably not something you want to do. But having this result, you can easily say, you know what, applying the carnosine patch is going to help the muscles throughout my body in some incremental way that's going to improve my overall exercise performance, which is precisely what many of us experience in the real world. So here is an attempt to quantify that. And this Friday, I'll have 4 more subjects going for volunteer echoes to continue to build out the data set. So for me, that's very compelling, you know, and, you know, something, hopefully when this is published, a tool that we could all use to persuade our friends and family and clients to try LifeWave patches. And again, none of these images would be ones that I would show in the abstract. So this isn't the proprietary data for the abstract, but it's a representative example that tells the story and that we can share at this time. So very motivating, very compelling for me to see results like that, and you know, hopefully have opportunity to share them on a larger stage. So that's kind of my 4 ongoing science projects. So keep your fingers crossed for all 3 of them, which are in submissions to different scientific forums, and hopefully things work out, you know, and as soon as they're published, we can all have them and show them and spread them around and use it to spread the message. That's kind of the slideshow presentation that I had.
Great. Thank you so much.
Yeah.
We have a few minutes left, and so I wanted to turn some time over to Ted